COVID-19, a pandemic. COVID-19 is a highly infectious disease caused by novel coronavirus 2019. Basically, how it spreads. When the infected person sneezes or coughs, the droplets containing the virus go into the air. When the healthy person inhales the air, the droplets containing the virus go in and infects the healthy person. The another way by which the disease can be transmitted from the healthy person is when the healthy person touches the surface where there are droplets containing the virus present. Day-to-day used objects like pen, paper, stethoscopes, computer mouse, mobile phones help in transmission of viruses. These are known as fomites. This virus, COVID-19, is most infective in closed and cool areas like aeroplanes, air-conditioned offices, ICUs, cinema theaters, etc. Because it is a cool area and it is closed inside. The incubation period of this virus is entry of the virus to the start of the symptoms. Usually it varies from 2 to 12 days, but the highest incubation period of this virus is 28 days. And now let's move to the infectivity rate. People less than 60 years old have a mortality rate up to 1%, less than 1%. And people above 60 years have a mortality rate more than near 20%, varies until 20%. In the symptoms there are three phases: the prodromal phase, the pulmonary phase, and the systemic phase. In the prodromal phase, there are normal flu-like symptoms. There is cough, there is sneeze, there is pain in muscles, there is mild fever, etc. Here there are mild flu symptoms, and 85% of the people suffer this, and most of them get cured. 15% of them go to the next stage. The stage name is the pulmonary phase. Here there is a pneumonia infection. There is breathlessness, need for oxygen, and need for ventilators. There are pneumonia symptoms. And some patients also go to the systemic phase. There is multi-organ failure. There is brain failure, lung failure, kidney failure, etc. Most of them die from this phase. They get cured or they die. The prevention is of two phases: the passive stage, passive measures, and the active measures. The passive measures, the most important is stay at home. Stay at home. Stay at home. If you stay at home, you will break the chain of transmission. One person infects 3 people in 5 days. So if you don't go outside, you will break the chain of transmission. And you will also keep social distancing of 2 meters. And the second thing is wash your hands frequently, that too more than 20 seconds. You should wash your hands more than 20 seconds. And only go out for necessity purposes like medical needs, medical checkup, and to buy groceries. When you go out, wear a mask and go out. And when you go out, you should also keep social distancing of 2 meters with others. and keep distance with everybody you see, and you see and also with your family members. So now let's move to the next measures. Those are the active measures. Active measures. First, we should stop people from coming from other countries to our country. We should stop from other countries to come to our country, because there, if they have contain the virus, they will come here and spread to others. The second thing is 3 T's. Those are trace, test, and treat. In the tracing, if a person has the disease, then whomever he had contacted, met, if he went to the shop and went to the grocery shop, to a hospital, all them should be quarantined who he has met, and we should test them he was with contact. After testing, if some of them were positive, we should treat them. Those are the 3 T's: trace, test, and treat. And we should quarantine as much as possible, quarantining and isolation. And the next thing is train medical health workers for handling the situation, and give all the necessary things needed for the health workers and the people who work in a hospital. And one person infects 3 people. This is very fast than other viruses. So, Arive Guru, knowledge is our teacher. We should spread knowledge about this to everybody around us by all the possible ways. And if you are tested for the COVID-19 positive, don't panic. 85% of them need no admission. Only thing is that they should self-quarantine them in the home. And they only get admitted so that they don't want to spread the disease to others. And the 15%, and in all the cases, only 2% of them die. So no need of panicking. And thank you.